Okay, so now we're at the IV portion of the videos. And right now our simulator has an IV in his arm, okay? It actually, he has an IV, but there's nothing running because we don't have anything spiking this bag right now. So technically he shouldn't have this in there. So, all right, so we have an IV, but we also have what's called an IV drain bag. So if your simulator has an IV in place, they will also have an IV drain bag so that we do not flood the simulator. That would be bad. And so that's what this bag is for, and it will say it on it what it is. And it's typically going to be hanging somewhere, so we'll put that one there. And so if we're going to start an IV, or if we're going to hang something for an IV, you are actually going to spike your bag, okay? And so when we're looking at our bag here, this one says that it is 5% dextrose. And so if I was to remove this label, then it's sterile water, okay? So look at what your bag says when you are doing your sim. It's either going to be what's here or what's on the label, all right? So always check that. Also, we reuse these bags. So there is a screw here that you can just pull out or unscrew like so. Like that. Now, don't turn your bag upside down to spike it because they've already been punctured because they're reused. So we're going to save these in the recycling bin. We're going to put those in the blue basket. And then we are going to make sure everything is clamped before we spike so that we don't flood anything. And spike our bag. All right. And again, everything is going to stay clamped, always, unless we're actually going to infuse. And there are some sims where you'll actually infuse and turn the pump on and stuff like that. But for this purpose, I'm going to connect my IV fluids. And let's say he was supposed to be on 70 mLs an hour, but you come in and you see a sticker that says 100 mLs an hour, all right? So in this situation, if you have the wrong rate on your IV fluids, you have a medication error, all right? So you would stop your IV, which means you're gonna remove this sticker and you're going to erase the rate, and now you've stopped your IV fluids and your IV pump. And I'm going to write with a dry erase marker 70 mLs an hour, and I'm going to reattach. Okay, and so now my patient is on 70 mLs an hour, 5% dextrose, and I would go through and do my IV site assessment. Make sure you ask the questions as far as, you know, what do I see? Am I seeing ecchymosis? Am I seeing edema? You know, all the questions you're supposed to look for when you're assessing a patient's IV. And then the other thing is don't unclamp anything unless we tell you to. Otherwise, it will flood, and we don't want to have a mess or an accident with the simulators. I think that's it for that. And then yeah. Oh. So, if your patient requires an IM injection or a sub-Q injection, typically they will have a little pad, so you can do your IM injections here. Sometimes we will have specialized task trainers on the stomach for sub-Q. Otherwise, we'll have sub-Q. This is an IM one, but we have another one that's a soft one. You'll actually inject into that on the simulator. So normally we would stick this on the simulator. This one is attached, so that's why it's safer. But, and then we have an attached sub-Q one for the belly that you can do injections for insulin. That'll be attached as well. You're actually going to go through the motions and actually stick. Everybody always says, do you actually want me to do this? That's the famous question. And the answer is yes. So that is your sub-Q, your IM, and your IV administration techniques in the Sim Lab.